President of the General Assembly, the Secretary General, Director General of WHO, Excellencies, heads of state and government, distinguished delegates. Universal access to healthcare is a defining feature of the modern social contract. Good health affords people dignity and enables them to use their talents to the full. Today, we renew our joint commitment to affordable care. No parent should have to choose between food and medicine for their families. Innovation, domestic resource mobilization, and international partnership are the key strategies for making healthcare accessible to everyone. Allow me to share some examples from Rwanda's experience. First, we have expanded our network of community health workers from 2 per village to 4. That translates into 1 worker for every 40 households, helping to ensure that no one is left behind. Second, to improve equity in access, Rwanda set a target that the walk to the nearest health facility should be no more than 25 minutes. Half the country now meets this standard, and the work continues. Third, 93% of Rwandan girls below the age of 13 have received the human papilloma virus HPV vaccine. This highlights the importance of gender equity as well as the urgency of including treatment for non-communicable diseases such as cervical cancer. Health insurance is the foundation of our policy framework. More than 90% of the Rwandan population is now covered with a mixture of community-based and private schemes. Of course, barriers to achieving high-quality universal health coverage persist in Rwanda as well as elsewhere around the world. It is the responsibility of everyone gathered here to take the lead in addressing these gaps and leave behind a legacy of universal health coverage for future generations. It is possible. I thank you for your kind attention.